So I still have that platform, especially in the Hispanic community. I'm in the Hispanic community on the air, either Telemundo or
Because
Univision.
you're bilingual.
That's right.
Yeah.
I'm fully bilingual, doing things on healthcare policy, enlightening people on things all of the time. I mean, I'm on the news all the time. So that opens up an avenue that most Republicans absolutely don't have.
Yeah, that's true. We're speaking with Dr. Annette Teijeiro. She's running for CD3. You know, it's interesting. Just today, there was a report of Hillary Clinton talking to a constituent and seeming to be shocked that the Obamacare prices were going up. And you have to wonder, either they don't care or they're completely oblivious to what's going on. You're a doctor. You're in the trenches every single day. Talk a little bit about what you're hearing what for your constituents and what you're seeing firsthand.
Well, firsthand, you need to understand that we all thought that it was going to be health care reform. That's what it said. But it wasn't really health care reform. It was actually insurance reform in a way. And what it basically did is it handed all of us only to having insurance as the way of paying for our health care. That, in essence, hands the power over to an insurance agency, a private company, who obviously donated a lot of money, had a lot of lobbyists, and the pharmaceutical companies and the big corporate hospitals. All of them stand to gain because we didn't see a decrease in cost and we didn't see a growth in workforce or access to care. So the legislation was billed as something, you know, if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. A family of 4, their premiums will go down $2,500. The complete opposite. And Gruber actually told us that they had to lie to us to make us do it. So you need someone in Congress that actually understands what it is that our weaknesses are. And we have to empower families and patients. All of my constituents know that I will fight for them so that they have access to quality, cost-effective health care. And all of my opponents in this race, none of them are doctors, so they don't understand the mechanism of how to make that happen.
Yeah, and one of the really important things is the insurance companies, to your point, they backed Obamacare because they thought they'd have all these additional customers, and now they're realizing how much money they're losing because the healthy people aren't signing up. It's only the sick people, which you and I saw coming a mile away.
Yes, we did see that. The other part of this is they still are winners because they've consolidated and they've learned, the big companies have learned to live within the boundaries of having this limited. But the problem is that the patients have lost. They've lost control of how they're going to pay for their health insurance. I don't know anyone that can say to me, oh, my deductible has gone down. That hasn't happened.
Oh, no.
The copays have gone up. Yes, people get subsidies, but those subsidies are precarious at best. Just like you said, there are a lot of exchanges, people on the exchanges that are looking to see, well, what happens if this company folds? Then that choice goes away. So it's not a stable environment. It can't be. It's not sustainable.
Right. Well, we knew that coming because economically there's no way it's going to work. And I know a lot of people whose deductibles are $5,000 and $10,000, making them essentially uninsured because they don't have $5,000 or $10,000 to shell out before they get any kind of treatment or insurance coverage.
Well, and they're also not allowed to put that huge amount of money inside of an HSA all at once. So as they draw down their HSAs to pay for all these high deductibles, they essentially have a financial barrier to be able to access that care, which is crazy. It's not what we wanted at all, and it's not what we needed at all.
Right.
Completely backwards.
We're speaking with Dr. Annette Teijeiro, who's running for CD3. Now, when you talk to your constituents, what are they saying are the most important issues to them, and how do they feel they have not been represented correctly?
Well, a lot of the constituents, you know, Nevada actually is still the highest in underemployment. So there are a lot of people out there that are frustrated. They couldn't find a job. They stopped looking for a job. We're at almost 14% underemployment, which means that with Obamacare on the overlayer, these people are working 2 part-time jobs and then having to pay for their own benefits. So that's what we hear. We hear about that. We hear about people very frustrated that their government just goes off and does things for the crony capitalists and takes their money and wastes it, allows people to fraudulently spend it, and allows people to have pretty much whatever they want as long as they have an elected official that's willing to do that. And I think that's why you're seeing someone like Trump, who actually breaks all the barriers. He has latched onto that emotional drive, that emotion that is inside of not only my constituents, but throughout the U.S.
Yeah. What do you think the Trump effect is going to be on people down ticket? Or do you think there will? Because there's so much fighting, and my attitude is, hey, listen, he's the guy. If he's the guy, I'm going to support him over Hillary, but there are still people saying they won't, and all you're going to do is give a vote to Hillary. What are your constituents, potential constituents, saying to you?
Well, a lot of them are Trump supporters.
Yeah,
They
now
turned
that-
out
yes,
in
they are.
groves.
Yeah, a lot of them.
They are the ones that are registered, and they're the ones who turned out in groves for Trump. So, yes, there are a lot of people. You know, is Trump the best candidate? Well, he's latched onto the emotion. He may be able to motivate people to come out to vote. Now, there is the negative side, which is precisely why he needs someone like me on the ticket, because I can expand and broaden the ticket both up and down. None of the other my opponents in this race can actually do that. You spoke to it earlier. I have the ability of bringing in the Latinos. I have the ability of bringing in the low-income people, the blue-collar workers that are extremely frustrated. Why? Because that's what I come from. Those are my roots. Those are my base. And that's how I can help and unite the party. Look, I'm not going to go out and do these crazy, manipulative type of things that Fiore's doing. Forget it. Because you know what? I'm a level-headed human being, and I want solutions. I don't want just dramatics. I'm not an actress. You want an actress? You want someone who's going to be on the news? Go for it. But you want someone who's going to actually solve things? Then I'm your girl.
Yeah. I'm a big believer it's not important that you're known, it's important what you're known for.
Exactly. And I have 4 decades in this community. I have over 2 decades of community service. A lot of people know me. That's a huge goodwill that I've built. And that gives me other avenues to reach out to people that may not normally vote or may not be motivated to vote. So that's a difference that I have that none of the other candidates, well, you know, you can say famous names, whatever. Yeah, but when it comes down to the ballot box, we have seen in the past people like Danny Tarkanian who have failed us miserably because the name recognition is there to start with. He opens up his mouth and we find out that, that's not something that we really want to stand behind. You look at the polls are driven by popularity. But, for instance, in Tarkanian and Horsford's 2012 race, the polls were saying that he was 4 to 5 points ahead of Horsford. Now, the most important poll, Heidi, is the day of the election.
Right.
And he was 8 points behind Horsford. So all that name recognition, the polls, you've gotten them. Maybe if you're in my district, I've gotten them. They're so skewed. They ask the right question to get whatever answer they want.
Absolutely.
So that then they can go to their donors and say, see, I'm winning. But the ultimate poll is the general election poll. And we have to be wise. We have to be wise and have someone on this ticket that can unite the party up and down. And we have to have someone that actually is going to do something when they get there. I have a proven record of doing things. And we can go through some of those if you like.
Please do. Speaking with Dr. AnnetteTeijeiro.
With the state legislatures for over 15 years. I want your listeners to understand that because neither Roberson, Fiore, Tarkanian, Matthews, none of my opponents all put together can say that they've actually worked on healthcare policy legislation for over 15 years. I can. Dr. AnnetteTeijeiro even recently worked on legislation that protected everybody from having the highest quality professional as an anesthesia provider at the head of their operating room bed.
And people should know you're an anesthesiologist. Those
I
who
am.
don't know, that's your specialty.
That's right. I am an anesthesiologist. They also need to understand what that meant because people like Roberson pushed through unanimously a bill, Senate Bill 181, that was going to introduce a new lower level provider to be at the head of your bed during surgery. These people aren't doctors. They're not nurses.
Wow.
So they were going to come in and they were going to supervise 4 of these individuals. Now, the kicker is that there were big corporations. Over the last 4 years, there's been over $250,000 spent on lobbying to get this done for 4 years. More than 4 years, actually. I have fought this process.
Now, who would have saved money? It would save the insurance company's money to put people who are not as qualified as you?
Oh, no, it wasn't going to be a boom for the insurance companies. What it was going to be a boom for was for crony anesthesiologists that were going to double their income. So if I was a selfish individual, I would have said, sure, go ahead, put these people out there so I can double my income. But it would have lowered the quality. So you would not have had your own anesthesiologist at the head of your bed at all times.
Wow.
So we also have nurse anesthetists, which are highly qualified individuals. They're like nurse practitioners that have had a lot of training, not only through nursing, ICU training, and they've worked in the field and then gone and gotten this, either a master's or a doctorate. But we were going to tone that down to somebody who basically had 4 years of college and maybe 2 years of training. You know, it's pretty extreme.
Well, that's the reason I think it's important to have somebody who does understand medicine.
Exactly.
You know, because you obviously understand it from a different perspective. A lot of politicians will stand up and talk about it, but when it comes right down to it, they really don't know the practical application every single day.
Well, here's the interesting part about that whole thing. The interesting part is that those people that gave that money to Roberson and his cronies were doing it because they saw the payoff. So we have to be careful because we only have 17 physicians in Congress. That's it. This is one of those seats. So we lose this seat to a non-physician, we're down 16 at best. We need people that are healthcare professionals inside of Congress because Congress is deciding to make all kinds of healthcare decisions, both in Medicare, Obamacare, obviously, and our Veterans Administration system.
Right. That's important. That's why you keep saying people need a doctor in the house. The website is friendsforannette.com, friendsforannette.com. Dr. Annette Teijeiro, good to see you, and good luck with your campaign. Always
Thank
fun to talk to
you. Always fun to talk to you, and I'd love to come back if the listeners have any questions, because I am the most qualified. I am the one who's been here for 4 decades. I am the one who has been a public servant, not a career politician, not a bought and paid for.
Nice to see you.
Nice to see you, Heidi.
Thanks, Marky.